If you have pain, numbness, or tingling that travels down your arm or into your shoulder or back into your shoulder blade, the exercises in this video can help it to feel better immediately. My name is Dr. Jared, and in most instances, these radicular symptoms come from a pinched nerve up in your neck. You see, up in your neck, we have multiple nerves that exit out our spinal cord and travel down our arm. And they're responsible for sensation and muscle control down our arm and into our shoulder. If that neck becomes pinched or irritated, either from a disc, from decreased joint space, posture, or even just local inflammation in the muscles in that area, it can cause these symptoms to travel down our arm and into our shoulder. They travel down the length of those nerves. But luckily, the right exercises can not only alleviate pressure on that nerve, but also just help the nerve to move and feel better overall. And so those are exactly what I want to show you in this video. I hope you get incredible relief from these. Let's jump in. Now, I know the title for this video mentions 3 exercises for your pinched neck nerve, but is it okay if I over-deliver? I actually want to start with 2 bonus exercises to alleviate the pressure on that nerve, and then jump into 3 exercises for the nerve health itself. So let's start with these 2 bonus exercises. I refer to these as my neck opening series. The first one is a lateral opening exercises or a lateral opening stretch. You're going to sit in a chair, and then with the affected side, so let's say I have those symptoms down into my right arm or into my right shoulder, I'm going to use that right hand to hook right underneath the chair. Now what I want you to do is lean your body away from that until we get a good stretch through the upper trap. You're gonna feel this shoulder blade kind of pull down in this direction. Now what you can do is slowly tilt your head over to the opposite shoulder until we get a good stretch in this upper trap area. I do want to mention that we first want to pull the chin back. If you do this with your head forward like this, you're not gonna feel it in exactly the right spot. So pull your chin back, sit up with really good posture, lean away from it, and then tilt your head away from it until, again, we get just a good stretch in that upper trap. What we're going for here is creating more space between each of our vertebrae. Now, if that feels okay, if you feel like you can maybe even tolerate a little more, with your other hand, you can go up to the opposite side of your head and just apply a little bit of overpressure just to enhance that stretch. If that feels okay, we're gonna hold that in a comfortable position for about 20 seconds and then repeat that 3 times. Now, it's important to note that I typically don't recommend that you do this to both sides. If you were to repeat this stretch to the other side, we're closing down those vertebrae we just opened and undoing that stretch we just performed. So please keep that in mind. And then this stretch you can do 2 to 3 times throughout your day. Stretch number 2 is a traction stretch to open up the back of the vertebrae. We're gonna start with a chin tuck, and so with 2 fingers, place 2 fingers right here to your chin, and then pull your head back over your shoulders, or retract your chin in towards your throat. You're not looking up at the ceiling, you're not looking down at the floor, it's just straight back motion with your neck. Now what I want you to do with your other hand is hook the back of your skull. So I'm gonna hook the back of my skull right here. I've still got these fingers right here on my chin. Now with my other hand, I'm going to pull up towards the ceiling until I get a good stretch through the upper part of the neck. It might even sneak down into that lower part of your neck as well. And so that's just a good traction force. We're creating more space between the vertebrae. We're decreasing pressure from discs. That's a simple, easy way to just supply a lot of relief. And again, I would hold for 20 seconds. I would repeat that 3 times, and then you can do that 2 to 3 times throughout your day. Now that the neck is stretched out and opened up, these next 3 exercises will improve the health and function of the nerves in the arm. But before we jump into those, I just have to ask, have you tried the exercises in this video? How have we done so far? I always love to hear from you. Comment your experience down below. If you have gotten some relief from this video, hit the thumbs up button so that YouTube shows it to more people, and we help more people that way. And thank you so much for your support and for doing that. Okay, let's talk about nerve glides. That's the next 3 exercises that I want to show you. The idea is that we're going to stretch and mobilize your nerve out of the area of irritation. Because we're working on the nerve directly, I have to explain the Goldilocks principle to you. We don't want to do too little, but we don't want to do too much. We want to provide enough stimulus that it's effective, but not too much that it results in significant pain or significant irritation in that area. So typically, I recommend that we start with about 5 to 10 repetitions of each of these, and then we go up from there. If we can work in another set of 5 to 10, that's how we would progress this. So keep that in mind, start small and progress slowly. Okay, nerve glide number 1 is for your median nerve. You can do these standing or you could do them seated, but what I want you to do is depress your shoulder blade, so push your shoulder blade down and bring your hand or arm out into about this position. Not quite 90, somewhere between 45 degrees and 90 degrees. You're going to rotate your palm up towards the ceiling, and then you're going to extend at your wrists. So you're going to pull your fingers kind of back towards yourself. And honestly, from here, you might feel some tension along that nerve that kind of runs along the top side of your arm. And if that's your case, if you feel that right there, then that might be a sufficient stretch for you. But if you feel like you can do even more than that, let's add the head motion into it as well. So I'm going to extend at the wrist while I flex my head in the direction of that arm. So I'm lengthening the nerve here at the wrist, but then I'm shortening it here at the neck. So I'm kind of pushing everything out that direction. I'm going to hold that for about 3 to 5 seconds, and then I'm going to go head over to the left while I bring my wrist, my fingers, up towards the ceiling. This position right here. So that's where the glide or the flossing comes in. From here, we can go back to the extended at the wrist position and then up just like this. And with this, once again, you might feel those nerves and those tingles kind of through the arm. I'm okay with a little bit of that, but I don't want it to be excessive. I don't want it to be too much. We're going to start with 5 to 10 reps, and then we can increase from there. Nerve glide number 2 looks very similar. It's for the nerve that goes down kind of the back of your arm, the back of your forearm. This is your radial nerve. And so now what I want you to do is, instead of extending the wrist back this way, we're going to roll the hand over and we're going to flex down towards your pocket. So we're up in this position and we're going to pull the hand in towards your hip, in towards this direction right here, until you get a good stretch through the back part of the arm and through the back part of the forearm. Once again, we can add the head nods to this, or we can add the head tilts to this. If I lengthen here, I want to shorten at my neck, so I'm going to come into this position right here, hold 3 to 5, and then come up into this position right here for 3 to 5, and then I can repeat that 5 to 10 times and then scale from there. The last major nerve in our arm is called the ulnar nerve, and this is how we do an ulnar nerve glide. You're actually going to come up into this position right here. Actually, I'm sorry, let's bring it into this position and then bend at the elbow. And so, kind of like if we're shooting a jump shot in basketball, so we're gonna come up into this position right here. Palm is up, elbow is bent, arm is abducted at the side. Now, for a lot of people, that might even kind of cause some of that numbness, tingling. We might kind of get some buzzes down into the pinky side with that one, but then we can work the glide into it. We're going to extend at the wrist, so we're lengthened here, so that means we need to shorten at the neck. So we're going to lean towards it as the wrist extends this way, hold 3 to 5, and then we're going to flex the wrist. We can even extend at the elbow a little bit and lean away from it here at the neck. And so from here, hold for 3 to 5, and then we're going to go away from it with some wrist extension for 3 to 5, or excuse me, wrist flexion, 3 to 5 seconds in each one of those. Repeat 5 to 10 times. I hope these help your neck, arm, and shoulder to feel amazing, and thank you so much for watching.